I have other insurance. Do I need Medicare? There is no answer that fits all situations. This must be decided based on your financial situation and the type of other insurance coverage you have. Employer group health insurance. If your employer has at least 20 employees, the employer group health insurance and deductible or coinsurance amounts are relatively low. In this instance, you probably don't need Medicare Part B, which is outpatient medical insurance. You could still enroll in Medicare Part A, which would be hospital insurance, since you have probably met your 10-year or 40-quarter work requirement, and therefore you will not have a premium for your Medicare Part A. Your employer group health insurance would process and pay any medical bills before Medicare. The employer group health insurance deductible and coinsurance amounts are high. In this instance, you may want to enroll in both Medicare Part A and Part B. Your Medicare coverage would act as a duplicate coverage and would process and pay their portion of any medical bills after the employer group health insurance considered the claim. You will have a Part B premium. Your employer has fewer than 20 employees. In this instance, you should enroll in Medicare Part A and Part B. Medicare will process and pay your medical bills before your group health insurance would pay. Retiree group health insurance. In this instance, your retiree group health insurance always processes and pays medical claims after Medicare, so you will need to enroll in Medicare Part A and Part B to have any coverage. If you have federal retiree health benefits, in this instance, you are not required to join Medicare Part B, but if you decide to enroll in Part B later, you will have a late enrollment penalty. If you keep the federal retiree health benefits plan and join Medicare, Medicare becomes the primary payer. You can switch to lower-cost federal plan for secondary coverage. If you have Veterans Administration health benefits, you are not required to join Medicare Parts A and B, but it's recommended since it increases coverage beyond VA hospitals and doctors. If you delay enrollment in Part B, you will have a late penalty if you lose your VA coverage at any time. You can have both VA coverage and Part D prescription drug coverage. If you lose VA prescription coverage and then enroll in Part D within 63 days, there is no late enrollment penalty. TRICARE for Life. If you are enrolled in TRICARE for Life, you are required by TRICARE for Life to have both Medicare Part A and Part B coverage. Medicare will process and pay any medical claims first. TRICARE for Life will consider the claims after Medicare pays. TRICARE for Life will only pay the portion of the medical claims that are left after Medicare benefits are carved out. If you decide not to enroll in Medicare, you will be financially responsible for any of the Medicare carve-out portion.